Hello, my name is Stephanie Rancic, and the title of the presentation is Increasing Competencies Regarding the Health Risk Screening Tool Among Staff Working with Individuals with Intellectual and Developmental Disabilities. Throughout the presentation, I'll be referring to individuals with intellectual and developmental disabilities as those with IDD. The Health Risk Screening Tool, or HRST, was created to improve the health of individuals with IDD by screening for health risk and destabilization. The screening tool is required by the Illinois Division of Developmental Disabilities to be completed for adults with IDD living in community living arrangements. The HRST generates a healthcare level, or HCL, for each individual screened, and that HCL correlates with their risk for health destabilization. The screening tool also provides individualized service and training considerations for those screened. So the problem identified was that at an agency that cares for and provides housing for individuals with IDD, a pre-survey found that 45% of frontline staff were not aware of the screening tool, and 47% were not aware of what a healthcare level is. Additionally, the agency had no standardized process in place when individuals were screened using the HRST and found to have a healthcare level of moderate risk or greater. So the purpose of this project was to increase knowledge about the HRST among frontline staff, workflow skills regarding communicating individuals found to have an elevated healthcare level, and proactive behaviors by staff prioritizing and implementing action steps for those individuals. The project took place at a nonprofit agency that provides housing for 110 adults with IDD located in the west and south side neighborhoods of Chicago, Illinois. The adults with IDD residing in housing through this agency are referred to as person served, and they receive 24-hour care by the agency's frontline staff. Process objectives for the project involved implementing a new standardized HRST workflow design. Nurses are the ones responsible for completing the HRST for the person served at this agency, so the new workflow design involved a nurse initiating a healthcare level communication form when a person served was found to have a healthcare level of 3 or greater. The goal was to educate 100% of nursing staff on the new workflow design and 75% of frontline staff on the HRST as well as the new workflow design. Additional process objectives were created to measure the success of staff implementing the new workflow design, and the outcome objectives and goals of the project were to see a 25% increase in staff knowledge regarding the HRST and healthcare levels, and for 80% of staff to be satisfied with the new HRST workflow design. Methods and results. 100% of nurses and 67% of frontline staff were educated on the HRST and the new standardized HRST workflow design during staff meetings. 6 persons served with a healthcare level of 3 or greater were chosen to implement the new standardized HRST workflow design with and to initiate a healthcare level communication form. The form had nurses write down the person served healthcare level as well as select 3 of the recommended action steps from the HRST as priority interventions. Unfortunately, many of the process objectives were not met, and that was due to staff turnover within the agency during the timeline of the project. Sufficient staffing was the resource that most impacted the work this project set out to do. There is currently a nationwide crisis regarding turnover and shortages of direct support staff caring for these individuals. Strengths of the project included that there was an increase found in knowledge regarding the HRST and healthcare levels among staff, and that of the staff that answered the post-survey, 100% were satisfied with the new workflow design. Recommendations for future projects warrant investigating factors affecting frequent staff turnover as well as improving retention. To promote the sustainability of this project, it is recommended that all new staff should be educated on the HRST and the new standardized HRST workflow design during their orientation. The HRST workflow design created during this project is a tool that similar agencies could use to increase the competencies of the staff regarding the HRST. This is a QR code with my references and additional project documents, and I would like to thank Bridget O'Brien, Ola Abayomi, and Sarah Ailey for their contributions and serving as additional authors.